Hello and welcome back to our final session of the summit. We want to thank you for joining us for track 3, Patients as Partners and Drivers. This is sponsored by Shire. My name is Katie Stevens and I'll be your host for the last breakout session of the day and of the summit. As a reminder, this track is being live streamed, and I'd like to welcome our remote attendees and remind everyone to download our mobile app to use some of our highlighted features like the live Q&A. Don't be shy, we're going to do Q&A throughout the presentation, so any live viewers, please feel free to start that as soon as you have a question. Our last breakout session will be presented by Amy Gadhia, Technology Transfer and Patent Specialist at the Office of Strategic Alliances at NCATS, NIH, and Mary Beth Campbell, Director of Corporate Partnerships at the California Institute of Technology. Today we'll be discussing collaborations and what it takes to keep transparency through paperwork. Our speakers will provide a discussion around the importance of written documents, and agreements, and they play a role in effective agreements. During this session, the nuts and bolts of collaborations. Prepare for the paperwork. So let's welcome our speakers.
So they've asked us if we can just sit here, so we're going to kind of stay here. But I think Amy and I wanted to thank Global Genes not only for having us, but for giving us the extra challenge of presenting at the last session on probably what is the most dry and boring topic of the entire summit. So we really do want to do our best to make this topic accessible and interesting and engaging for the audience. And so we actually are going to really try to keep this pretty fluid and do back and forth and really be looking for engagement from the audience, questions. If you're totally zoning out and just seem totally bored, just raise your hand and we'll try to bring you back. But just a little bit about me. I'm the Director of Corporate Partnerships at Caltech within our Office of Technology Transfer and Corporate Partnerships. So we handle sort of the traditional patents and licensing, also new venture startup support, as well as building relationships with companies. I'm also here as a parent of a young son who has a rare genetic disorder known as Bloom syndrome. So with that, I'll turn it over to Amy to introduce herself and to do a short little poll on the audience.
Thanks. So I'm Amy Gadhia. I'm a Tech Transfer and Patenting Specialist at NCATS, which is the newest center of the NIH. NCATS houses the Office of Rare Diseases Research for NIH, and I'm with their Office of Strategic Alliances, so I do agreements, I manage patents and licensing. I'm a patent attorney by training. I worked at a university tech ventures office for about 9 years before. I'm humbled, inspired, and honored to be here today. So you've heard a little bit about us. We thought we'd do a poll so we'd get to know a little bit about you. Just by a show of hands, could you let us know if you're from a university? Okay. How many are from the government? How about foundation? Okay. How many of you are patients or patient advocates? All right. And then how many of you know what tech transfer is or have ever been involved in an agreement? Okay, terrific. So for those of you who raise your hands at the end, we look forward to hearing some of your perspectives too. Feel free to jump in at any time.
Yeah, so we sort of structured this kind of as if you didn't ever know what a tech transfer office was. And so some of this might be remedial, but we wanted to kind of get everyone on the same page. So we thought we would just give an overview of TTOs, which is our introduction to alphabet soup that you'll be hearing today. The commonly used agreements that are used in setting up research collaborations, the differing perspectives that we see from university, government, industry, foundation, what those perspectives are, and just kind of give us a shared context. Some of the pain points that we have seen in our negotiations, and from the, at least university and government perspective, what are non-negotiables that really just we don't have the authority to change, and so it's just not even worth trying to negotiate. And then we wanted to provide some links to where you can find more information, specifically on template agreements, because I know that was mentioned in the session description. So I have Q&A at the bottom there, but we really do want questions throughout. And so if you just have a question, just raise your hand, and we will take that. So I think some of you might be in this position, or might be thinking about you'd be in this position in the near future, where you've identified that you want to collaborate with a researcher, a scientist in a lab, but now what? What do you do? One thing to point out, again, this might be basic, but we've found that some people don't know, is that the researchers themselves working within a university or in a government lab don't have the ability to negotiate agreements themselves, that this actually has to be handled by an authorized official within the university or lab, and typically that authority resides within the Technology Transfer Office or the Office of Sponsored Research, the OSR, to negotiate and actually execute those agreements. And if you're not at the point where you've actually identified a research, but you're just starting to think about these collaborations and you want to know who you might work with, what we find is that while some universities and labs do have the kind of bandwidth and resources available to field a call or an email from you and to try to help you identify researchers who might be working in the space that you're interested in, for the most part, we just don't have those types of resources. And so it's really can help move things forward if you've already identified a researcher, even if you haven't necessarily reached out to them yet, but you sort of say, here's the person that I'm interested in working with. It just helps us to kind of focus and figure out who's going to be involved, what IP considerations might be involved. So to the extent that you can do your homework before coming to the Tech Transfer Office or the Sponsored Research Office, that's really helpful. Is that consistent with NCATS?
Yeah, definitely. We're a small office, so it's scientist-driven.
Yeah. So what do TTOs do? TTOs really started proliferating at universities and labs in the early 1980s when the government turned over the rights to inventions that were made with federally funded R&D, and they were tasked with basically translating those inventions from the university or lab to the outside world. And so that has historically really encompassed a whole range of activities that support technology development and partnership, including the negotiation of these agreements that we're going to be talking about today. Once a collaboration opportunity has actually been identified, then we sort of work to put that framework into place. And although we're going to be talking about various agreement types and structures, what I would say is that there's really no one size fits all. And so what we like to do is get involved early in the conversation so that we understand what you're trying to accomplish, what the scientist is trying to accomplish, and then we can kind of put together an agreement that makes sense for that given collaboration. And TTOs oftentimes are the external-facing office, but on campus, they are working with a lot of different offices, including the OSR, including general counsel, research compliance, export control, I would say foundation relations when we're talking about patient foundations. Basically, we're kind of the central point coordinating between all of these various offices that I'm sure you didn't even know exist on campuses.
And to Mary Beth's point about engaging with the research institution early, I think it's helpful to do that because the right personnel will be involved in the discussions. So with the university, I know they have TTOs, sponsored research offices, and others. And at my federal lab, we have an Office of Strategic Alliances that handles a number of agreements. We work with Office of Policy and General Counsel. So if you engage us early, we can bring the right stakeholders to the table.
And hopefully take care of that behind the scenes so that you're not having to see all of that sausage making. So if we had to think about the activities that we're involved with most frequently in tech transfer offices, they kind of fall into these buckets. Sharing materials and information from outside the lab, either starting from inside the lab and going out, or outside the lab coming in, protecting technologies through patents and copyrights, which we sort of broadly call intellectual property, licensing technologies, usually licensing that intellectual property to help further develop and commercialize the technology. Obviously, at a university or at a lab, we don't take something all the way to the stage that it's ready to be developed. We have to license it to somebody else to further that along. Part of that is developing partnerships and collaborations And oftentimes we are tasked with also trying to partner with outside organizations to promote economic growth, either regionally or nationally. So in these buckets of activities, there's kind of commonly used agreements that we use to formalize these relationships. And this is, again, where the alphabet soup comes in again, where we have CDAs, confidential disclosure agreements, non-disclosure agreements, material transfer agreements, MTAs, research collaboration agreements, RCAs, sponsored research agreements, SRAs, cooperative research and development agreements, CRADAs. And so what we're going to do, and Amy's going to kick it off, is kind of walk through what each of these agreement types are and when they're used. And hopefully we haven't lost you already.
So the first one is the confidential disclosure agreement, or a non-disclosure agreement, NDA, CDA, as they're oftentimes known as. I think of this as a gateway agreement, typically the first step in a collaboration. So if you're going to be sharing proprietary information or getting proprietary information from a third party, you might consider putting one of these agreements in place. But before you do, think about what type of information is being shared. Is it something that was published in a Nature article, or was it published in a patent application that you saw online? If it's already in the public domain, you don't need to bother with this agreement. On the other hand, if it's something that you're thinking about publishing on, or the other party's thinking about publishing on, you might consider putting this agreement in place, because once a patentable invention is publicly disclosed, you lose the right to file a patent in most countries in the world. And in the US, you start that statutory bar clock ticking. So you have a 1-year grace period from when the information's been disclosed. So a CDA can be really helpful to avoid that. You can't transfer research materials under a CDA. Like I said, it's a gateway agreement. It's a first step. It's typically just a few pages long. It's not meant to be negotiated heavily. You don't want to spend a year doing a CDA. You want to have the conversation and move on and put a collaboration agreement in place if that's your end goal. Also, it can be one-way, meaning one party sharing information, or two-way, both parties sharing information, or it could be a multi-party agreement. I just worked on a multi-party agreement the other day, where all parties are sharing information. You're going to specify the information that you're sharing and include a term.
One thing I would say here is that sometimes we get asked by outside organizations to just enter into a blanket NDA or a blanket CDA, and that really, we can't do that, but you wouldn't want us to anyways, because we couldn't actually enforce it. We wouldn't know which conversations were happening, so that's really something that we won't do.
True, and we also won't include trade secrets. If it's a trade secret, don't tell us. Don't tell the government about your trade secret. We're not going to be able to keep it.
Don't tell universities. We leak like sieves. So
we're not going to be able to keep it a trade secret. So.
And the last bullet point too, that I think one thing that we see is sometimes we negotiate a CDA or an NDA, and then down the road when we're trying to enter into a collaboration agreement, the other party will say, well, we already have the CDA or the NDA, and basically what we've agreed to in the CDA or the NDA is not really going to be applicable for the collaboration agreement. So just think of it, as Amy said, as sort of this gateway agreement that really just governs those initial conversations.
So the next one here is a material transfer agreement, or an MTA. It is really what the name implies. It allows for the transfer of materials. It'll include permitted uses of the materials. Of course, you'll have to specify what the materials are. It will include some language about proprietary information, some confidentiality language, and it will not include any rights to inventions. So for example, if you're transferring some biological material that has an underlying patent filing or issued patent, you don't get the rights to the intellectual property. You don't get rights to the patent, so you can't commercialize that. But you do get the right to use the material for research purposes. So it can be extremely useful. Again, you can do an MTA in or an MTA out. So if you have some materials to share, you can can send them under an MTA. If you have some materials to get, you can receive them. I think here the pro tip is about the Master Uniform Biological Materials Agreement, or the UBMTA. A lot of institutions have signed on to this. Even if you haven't, you're a small foundation or a small patient advocacy group, you might want to look at this and see if it fits your purpose. It's a good template. Like I said, lots of institutions have signed on to it, so it serves as a form, basically. You don't need to negotiate it. Again, the name here implies what it is. It's a research collaboration agreement, or an RCA. Me personally, this is how I spend most of my time at work. I do a lot of these research collaboration agreements. I guess simply put, it's a combination between a combination of a CDA and an MTA. It's a little bit more than that, though. There's a research plan that both scientists who are collaborating, or both institutions, will agree to. There's also some language around data, publications, use of name, typically. There's also some mention of intellectual property, in the sense that there could be joint intellectual property that comes up from this collaboration. However, unlike a CRADA, which we'll talk about in a little bit, there isn't any language in there that provides an option to a license, so you don't have that. If you do come up with some joint intellectual property, you'll have to figure out how to license the other party's rights. This doesn't provide an automatic option. It is meant to be a simpler type of collaboration agreement. So for a federal lab, they cannot accept money from a non-federal partner under a research collaboration agreement. It's typically 8 to 10 pages long. It can be signed by the institute or center tech transfer director. So my boss can sign RCAs, unlike a CRADA, which we'll talk about in a little bit, that requires NIH level clearance. But this is really handy for two institutions to come together and say, we're going to do this research together. These are our roles and responsibilities, and this is how all these other provisions that are typical to a collaboration will be handled.
Yeah, and I would say that universities typically don't enter into these sort of unfunded research collaboration agreements unless they're requested by the other party. So university scientists usually collaborate with other parties. If no money is being exchanged just sort of on an ad hoc basis, sort of kind of a common understanding of what the parties are hoping to accomplish, and then sort of publishing following kind of academic norms. That, sort of ad hoc approach has its pros and cons, but in our experience, most PIs, principal investigator scientists, don't want to actually do the paperwork until there's actual money coming to their lab.
And from the federal lab perspective, we want to make sure that publications are addressed in this type of an agreement, so that if there's any disagreement later, they can point to the RCA and say, see, this is what we talked about.
So this next level of agreement that we're going to talk about, and universities is commonly called a sponsored research agreement, and at labs is called a CRADA. And so we have two different slides. They're semi-equivalent, but you, again, sort of the alphabet soup might see different acronyms, and so we wanted to lay out both of them. So under a sponsored research agreement at a university, the sponsor, who's the outside party, either the foundation or industry, will work with the researcher to define a scope of work with potentially deliverables, a timeline, and in exchange, the sponsor pays for that research to be performed. But although this might sound like a work-for-hire arrangement, we really don't consider ourselves as a contract research organization. There's a lot of uncertainty. There's a lot of university resources that are going into a project, even if that individual graduate student or whatever case might be is being funded. And so that's not the type of relationship that a sponsored research agreement is intended to encompass. And so we will almost always insist on resulting the IP, and some of this is not even just our own internal policies, but comes from the fact that the vast majority of our funding is federal funding, and that does not allow us to assign any IP that has been developed with federal funds to another party. And that even though there is the scope of work and even potentially, deliverables, it's still research, and so the outcomes are not guaranteed.
And so by assign, Mary Beth, you mean the transfer title?
Transfer title, yeah. So does everyone know, do people know the difference between assigning title and a license? Or so when an invention happens and a university or a lab decides to patent it, it is actually in the name of the university. So the university owns that patent. And patents normally can be assigned to another party, just like I could sell my house to Amy. But under federal regulations, we as a university can't do that formal sale assignment of the IP. We can enter into arrangements like an exclusive license that may give the other party the vast majority of the rights, but we can't outright assign, walk away, and is that accurate?
Yeah. Similarly, we also can't assign title to a third party.
And sometimes you'll hear European universities are able to assign IP, and so sometimes we've had cases where people say, well, I've worked with another university and they assign their IP, and then I say, who was it? And it was the European.
Same with Canadian universities.
Canadian universities too, yeah. So just sort of thinking about the mechanics, again, maybe that people know this, but when a project is funded through a sponsored research agreement, typically it's not the scientist who you've been talking to who's going to be in the lab doing the experiments, it's their graduate students or their postdocs who are working in their lab. And under these sponsored research agreements, although we wouldn't assign the IP, what we would often give is a first option to license any resulting IP. So if, as in the course of the work, the researchers came up with something that they thought was patentable and the university decided to patent it, we would basically offer it up to the sponsor as a first licensee. And one thing that we have seen in these sort of setting up these sponsored research projects is oftentimes people are very excited, they're talking about getting the project in place, they're talking about the scope of work, who's going to work on the project, but they neglect to consider the university's overhead rate that's applied on top of these direct costs. And so we've had a lot of sort of hurt feelings down the road when suddenly the cost of the project goes up by 50%. So you could ask about that. Do these costs include overhead?
So before I talk about CRADAs, I'll just go back to the point about assignment. And the reason why that's important, why universities and the government will retain title, is because we're mission-driven organizations. So while we'll partner with industry, if at any point the technology isn't being developed for the public health benefit, we can claw it back. So this slide talks about the CRADA, or the Cooperative Research and Development Agreement. I guess it's the most similar to an SRA that we have. This is the mechanism by which the federal lab can accept monies or funds from a third party, non-federal party, in order to do research at the federal lab. So just like universities, we're not a contract research organization. The research at the federal lab can't be directed in a specific way. However, we can collaborate with a non-federal party where there's scientific synergy. We can come up with the research plan, just like the research collaboration agreement, and work together. The federal lab can provide services, personnel, equipment, but we don't ever provide funding under this mechanism. Why might you put in place a CRADA rather than an RCA? The CRADA includes it includes the right to negotiate a license, an exclusive license, to any joint intellectual property that comes from the collaboration. And this is really important because for any intellectual property that comes from a federal lab, we're obligated to post it in the Federal Register. We have to tell the public about it and allow anyone and everyone to put in a license application if they're interested in developing the technology. So you can imagine if you've collaborated with the federal lab to develop to work on the research and you've generated some intellectual property, you'd probably want to tie that up and have an exclusive license or exclusive rights to that technology. You wouldn't want it to go up on the Federal Register and have a competitor secure some of the rights. So in that case, you'd enter into a CRADA. Let's go back to the slide with the drug candidate. So you might enter into a candidate or into a CRADA where you're going to develop a drug candidate together. You might come up with some composition of matter intellectual property together. That's something that you might want exclusive rights to. However, if you already have composition of matter IP and you're working with NCATS to do some screening, then in that case you might do a research collaboration agreement. So you have to think about what your end goal is and pick the agreement mechanism carefully. Talk to the Tech Transfer Office, the Strategic Alliances Office to help you. Some folks have the attitude, well, we should just do a CRADA for everything. We want to lock up everything. Well, a CRADA is about 3 times as lengthy as an RCA, and what that means is there's 3 times as many provisions to negotiate with the federal government, and the CRADA has to go up to NIH level clearance, so all the institutes sit together and talk about every CRADA that is being negotiated. Needless to say, it can take a good bit of time. But if that's what you need done, we're happy to work with you on that.
Yeah, I think that just sort of echoing the sort of getting involved with the tech transfer office early and talking about what it is, where you are and what you want to accomplish, and they can help guide sort of what type of agreement might be used, and even talk to you about these sorts of things like, well, with the collaboration, are you actually envisioning that any inventions are going to come out of this, or really is it fundamental science and not anything patentable is likely to come out of it? So we try to be a resource for both sides, I guess, is what I'm saying. The last mechanism that we wanted to talk about was actual gift funding. This is often used actually with patient foundations. At universities, these basically can be considered conditional donations. So under a gift agreement, a donor can give funds to the university, to a specific lab, to a specific research area, but it's not going to be a defined scope of work. There's certainly no deliverables, and there's nothing about IP, really. If anything is developed with that funding, then the donor has to negotiate it at an arm's length transaction, just as if they were anyone else. You know, it can provide access to facilities and personnel, so not in the sense of actually your scientists using facilities, but it does, at least at universities, kind of give you an in to talking to the researcher, hearing about the research results, better understanding their work and the facilities that they have. And basically, even at universities, I think this is especially true probably for NCATS, that the scientific interests and the institute have to be aligned. So you can't give a gift for us to, I don't know, I won't even go there. But basically, there is some level of review that the university has to accept, and that they're okay with the donor's intent of how the funds are going to be used. Do you want to say something about the conditional?
Yeah, I was just going to say that we've accepted some conditional gifts from foundations where the foundation has supported a postdoc, for example, in a researcher's lab where there's scientific synergy. The researcher is interested in a specific rare disease that matches the foundation's interest, and so we can accept a gift and use that mechanism in order to support a postdoc to do research.
And one thing that I don't think we have up here, but gifts typically have lower overhead rates than the full research agreements, and so it's oftentimes an attractive option for foundations who are cash-strapped. But again, it comes with those caveats that you're not getting everything buttoned up in the same way that you would with a sponsored research agreement.
Yeah, or with the CRADA, you're not getting any right to negotiate a license or anything of that sort.
So before we actually move on to the perspectives of the different groups, I kind of wanted to say, for those of you who have done these agreements in the past, does this seem comprehensive? Did we leave anything out? Is there anything else that you should think about that we should have mentioned?
I will say I've done a CRADA agreement with NCATS, and I just want to credit the NCATS team because they were incredibly comprehensive in the way that we worked through it and letting us know every provision and what everything was, both from the industry side and with an advocacy partner on that CRADA as well. There were a lot of parties and there was a lot of complications, and
Oh, thank you so
You want
much.
to repeat what she said?
I,
You want to repeat what she said?
if I repeat what she says, that
It's going to sound like
might sound like an infomercial.
she basically said
I should have
NCATS
given
is
you the
awesome.
mic.
Yeah.
Can you tell us where you're from?
Yeah, I'm from Hertoken.
Oh, okay. Yep.
Josh.
So I think it's important also to contrast these grants and constructs with possibly with other sorts of opportunities that a foundation might have, like for example a CRO. And also you can enter into a contract also with the university where you do get into specific deliverables. So
Yeah, and when we,
between grants and contracts.
exactly, yeah.
Okay.
And so, I mean, the focus of this was really research collaborations, but Josh from Notre Dame pointed out that there's this whole other universe of how a foundation might spend its money. One could be working with actual contract research organizations that exist to do specific preclinical work and where you will own the resulting IP in a work-for-hire type arrangement. And then even with universities, there are things like technical services agreements or contracts where you may be able to actually own the resulting IP. I would just say from the Caltech perspective, and this may be university dependent, that's a small fraction of what we end up doing, and those get a lot more scrutiny as to why is the university engaging in this type of research. But there may be groups within other universities that have different philosophies.
We're not generally interested in doing them either, but sometimes people that approach us are. And so it's important to distinguish
Yeah.
what those other options are and say, this isn't quite what we are. We don't work with specific deliverables usually.
Yeah.
Most of these agreements don't. And if you do, you might want to look elsewhere.
Yeah, and Josh was just sort of pointing out, sort of at the outset, kind of saying what a university does, who we are and who we aren't, is an important point.
This may also not fall under research collaborations per se, but when we distribute data from a registry to investigators that work for institutions, we have a model where we have a researcher distribution agreement. I don't know if that's an official term or just something that we use, but that the institutional official needs to sign, and then individual researchers need to sign a joinder agreement to that. So is that a common model, or?
So the question was, in sharing registry data to institutions, it sounds as if they have a, what did you call it? A researcher distribution agreement that is signed by the authorized official at the university, and then there's an addendum that the individual investigator who's working on it signs. And I think that what we sort of see that when there are, certainly around data, when there are going to be terms and conditions in how the data is stored, how it's accessed, who has access to it, because again, that would not be operated out of the tech transfer office. So we usually want the researcher to know what the obligations are in receiving that data, and that they agree, read and acknowledged, basically, that they are going to abide by that. So we oftentimes just have sort of read and acknowledged line. You know, we didn't talk actually about like data sharing. For us, data sharing sometimes is the equivalent of like a material transfer agreement.
Similar.
Yeah.
Yeah.
So I might also add that you called this technology transfer office, and that every different school is going to have a different name and a different type of front door and stuff. So you need to kind of look at the spirit of what's been presented and think about that it's probably going to exist in a slightly different form at each school.
Very good point. As I mentioned, we're called the Office of Strategic Alliances.
We're the Tech Transfer and Corporate Partnerships Office. I know a lot of offices are rebranding Office of Innovation or Office. So yeah, that's a good point that.
Some call themselves technology ventures.
Yeah, I have found typing in Google the university name and Tech Transfer Office will usually get you to the right place, even if that's not what the university is called, or what the Tech Transfer Office is called.
Can you talk a little bit more about overhead? Because that's something I think that sometimes has a little bit of a negative connotation, but most people, if you go back and sort of explain what it is and what it's good for, if you're paying $50,000 for a postdoc, they still need a fume hood to work in it, and things like that. So there's just, I think a lot of times it's overlooked.
Yeah. No, Josh was pointing out that we talked about overhead and that there might be different overhead rates applied. And it's oftentimes I hear people talk about it as if it's a tax on the dollars that we're sending to the university, and it's really not. I mean, so all universities basically have a negotiated rate that they work out with the government that sets their overhead for all the facilities and administration that's involved in keeping the fume hoods going, keeping the lights on, all the infrastructure that's basically needed to allow the research to take place. And so that is our sort of standard overhead rate that we expect for any research funding that's coming in, especially if it's going to have a scope of work and deliverables. There is some sort of on the inside, some mechanism. Some foundations basically say we will not allow more than 10% indirect costs, for example. And the way that we handle that internally is that we require the researcher to make up the difference, which, honestly makes it, the researcher is less incentivized to work with the foundation. So I think we wanted to go on to the different perspectives. So maybe we should have even started with this.
So we're going to talk about the different perspectives. First, university government, and I think we're going to talk about industry next, and then foundation perspectives. So as I mentioned, research institutions are interested in doing mission-driven work. We're charged with bringing technologies forward for the public benefit, for the public health. We may need to include some diligence provisions, some clawback provisions, or some way to terminate the agreement if the technology development isn't going as we thought it would. We always make sure that researchers have the freedom to continue doing their research whenever we enter into any agreement, that they have the right to publish. With academic institutions, I've heard the mantra, publish or perish, so we won't ever take away the publication rights of the researcher. That's also how information is shared, and we understand and appreciate that. And as mentioned before, universities and government labs are not contract research organizations. So while we'll collaborate around research where there's scientific synergy, we won't be directed to do specific research like a CRO.
And I think, I'm not speaking from industry myself, but what we hear from the industry partners in doing these negotiations is, from where they sit, they're charged with making profits and generating returns for their shareholders, and so they constantly have that in mind when they're thinking about where to spend their money and where to collaborate. They want ultimate flexibility with the IP. Most companies would prefer if we could just outright assign IP to them. As we already talked about, we can't do that. They may also want IP for different reasons than bringing the technology forward. So companies use IP, for example, as defensive purposes in case they get involved in litigation down the road around IP, or to actually use it to enforce IP against third parties. If they have entered into this research collaboration, they're really going to want to direct and own any improvements, or if they have IP already, they basically want control. And again, sort of going back to where they have different strategies, they may want to keep results secret and delay or prevent publications to have a competitive advantage over others. That's sort of the things that we see from corporations. I don't know, Josh, I know you do corporate relations. Anything else that should be added?
So here's the foundation perspective. Neither Mary Beth nor I have worked for a foundation, but we've worked with many foundations across the table, and this is what we've heard. So many folks from foundations raise their hands. If any of this looks off or you want to add to it, please do. So to us, it seems that the mission of many of these rare disease foundations is to find a cure for their patient population so that their patients can lead full, productive lives. We've seen that foundations may provide funding for innovative research, They may provide expert care through their networks of care providers. They may provide support for their patients through patient registries, for example. So there's many different ways that they try and support their rare disease community. We've seen that some foundations want a return on their investment. They want a share of any royalties if there's any licensing that's done. I think the point that we want to make is that it's important to recognize the total investment. So a researcher might have been working in that area on that rare disease for 20 years, and the foundation may just see the tip of the iceberg. So it's important to keep the entire research, the entire investment by the university or the federal lab in mind before asking for any sort of return on investment.
And I think this is where sort of initial conversations around what you're trying to accomplish, not only just with the research collaboration, but how you see how this collaboration fits into your overall strategy is really helpful, because sometimes we can get bogged down in these negotiations around what we see maybe is unfair, but maybe more immediately just an administrative headache in terms of trying to do the accounting on these, and for not a lot of money, and our researchers kind of ultimately say, look, it's not worth it, and the institution says it's not worth it, which is a missed opportunity in my mind. So it's really helpful at the outset to kind of have a conversation about what is it you're trying to accomplish, and then how does this fit into the bigger picture for your foundation overall, because I do believe, and we'll talk about how some bridging these different perspectives can be accomplished, but it's better to be dealt with sort of upfront in those initial conversations, and not just in a negotiation of 5% versus 10%, because
or when you're exchanging red lines back and forth. So do any of the foundation folks have some additional perspective on this that they could share? Yes, please.
So I'm with the Gadhia Research Foundation, and I'll say I totally agree with the first 2 points. I would just expand on the third point about, I'm the executive director. Part of my charge is to get the best return on investment for all the funds that we raise from our donors. And more so with industry, I would say, than with either academic institutions or the government. We're often in a position of, being kind of treated like we're coming hand in hand to ask for something, because we're this small little foundation and we're dealing with, the industry partner or something like that. And we kind of flip that on its head, and we are saying, look what we're offering to you. We are bringing you the natural history studies. We are bringing you the patients. We are bringing you the years of research, outside of what you've done that has gotten us to this point. So I just, from a foundation standpoint, I would emphasize that, for smaller foundations, you don't always have to feel like you're going hand in hand to some of these larger institutions.
And I have to add a little bit too. I arose in a situation where I was helping get a very small subsection of rare people involved in a possible study. And so I said, is there any opportunity for IP? And they said, absolutely not. It's already buttoned up. So really always a sense of being kicked out. Actually, never. It's all done. We've been.
So the first comment, I think, was that that foundations actually have a lot of valuable things to bring to the table, and I think we were trying to capture that also in the second bullet. It's not even just the funding. There are these other things that are valuable in a research collaboration, and we definitely agree with that, and that should not be discounted, and that should be part of the overall agreement too, is that maybe there's some small amount of funding that's going along with it, but if there's other in-kind data that's extremely valuable, that should be captured in the structure of the terms. The second comment was, correct me if I'm wrong, you were saying there's a feeling that maybe the university or the other partner basically says, everything's already been developed, there's not going to be any IP because we've got it all covered.
Or that you're not going to share in any IP that comes from this?
Yeah, it's pretty. That's the standard. Because I even asked somebody at the Genetic Alliance, and they said if you can figure out how to break that wall, that would be something. So it sounds.
Yeah. I mean, just saying, it does get really complicated because patents are so esoteric. And so, it really takes somebody who's going to be looking at the collaboration and, okay, really, what is going to come out of this that might be patentable? Not only just patentable, but then is maybe going to lead to a royalty, down the road. And so there has to be a lot of trust and transparency. And I think this is something maybe where Global Genes could help support groups is, this is a lot of, again, sort of esoteric topics that individual foundations probably can't take on in their own capacity. Most of them can't. So advising on those types of issues would be helpful. So
I will say I'm surprised to hear that that's what you've heard, because NCATS, for example, well, I would think anybody who holds a patent wants to get inventorship rights. So if you've contributed as an inventor, whoever holds the patent would want to get that right, because otherwise the patent would be invalid. And we have some IP, it's joint with, I think, 6 other institutions. One of them is a patient foundation. There are some universities, a smattering of other folks, and it was really important to us to include anyone and everyone who should be included as inventors, and then deal with this sticky multi-party agreement, because it's worth it. So it can be messy, but it's important to get that right. So maybe that's, I don't know if stick is the word, but maybe you want to wave that around, like, hey, if you think you contributed as inventors, right? There's many ways to contribute to a project, and
but I also think it comes down to the trust in the individual collaborator. I mean, I won't say that I've seen this at Caltech, but we have seen where certainly a researcher probably has in mind how they're going to commercialize the technology, and they think, okay, I'll just get a little bit of funding from not necessarily foundation groups, but maybe this corporate sponsor, or I'll get a gift, or I'll get NIH funding, and they have in mind how they're thinking this technology will move forward, but they're not necessarily sharing that with their sponsors. And so that comes down to sort of the individuals and making sure they have trust and alignment on how people feel the project is going and where the technology could go in the future. So we wanted to talk a little bit about how we've seen the ability to bridge some of these points of contention when we're talking about commercializing what we've called here government-funded IP, because usually the vast majority of the IP that's developed at universities has been government-funded. I hope that we have not scared you off totally, because these research collaborations and licensing can happen, and they happen every day. It just involves some amount of compromise and understanding the other party's position. Publications we've touched on already. We will allow for publications to be delayed for a limited time frame for the foundation or company sponsor to review and comment. It's really important for us from a conflict perspective and academic freedom that we are not required to accept comments if there is actual confidential information that has actually been put in the publication and you want removed, we can remove that. Or if there's information in there that you think would be patentable, we can hold up the publication for patenting, but we can't make a requirement to accept those comments, and we can't delay it indefinitely. And this is not just from our sort of academic policy. There are broader things like universities and probably government labs too. We sort of tell, we say that most of what we do is not export control, it's fundamental research, and so it doesn't fall into these export control restrictions. And part of the way that we're able to argue that is because we say everything that we do is basically going to be published, and it's not secret. With respect to actual IP, the company or the foundation may jointly own IP, and that really depends on the institution's policy. So at Caltech, we sort of stick with the model that ownership follows inventorship. So if there's an actual collaboration and people are contributing, and there can be joint IP, but we wouldn't automatically just agree to joint ownership of IP. And as we mentioned before, sort of first right to license. And I think that Amy sort of touched on this point. So instead of basically doing assignment of IP, we could do where we own the IP, but we give a grant back to the foundation, and we can structure things such that they're sublicensable to other research awardees if there's other institutions that you want to work with. There's sort of the permutations are endless. It really just depends on what we're trying to accomplish. Do you want to add anything?
No. So here are some of the non-negotiables when working with research institutions like universities or the government. Indemnification, reps and warranties, those are the risk provisions. So our stance is whoever is putting the product in the market takes the risk, but for putting the product in the market, there may not, the research institution or the government wouldn't be exposed to that market risk. We also include use of name provisions. You might be able to factually state that you worked on something with NCATS, but you couldn't use us in a commercial or anything of that sort because we're a government institution, not a commercial entity. Buy-dole rights I know with universities, they have to have substantial U.S. manufacturing language in there if they're licensing exclusively some technology that was funded by the government and some government use license language. So the reason why we put this slide up here is these truly are non-negotiables. If you're a small group sending your agreement to a general attorney who's never worked with a research institution, you can show him this slide and say, please don't run up our bill trying to negotiate these. Really, they don't budge on these. Focus on some of the other provisions where they have some flexibility.
Yeah, and I would just reiterate that point. I mean, we not only see this sort of with smaller foundations, but also startup companies where, they have an outside attorney who's basically working for them, and the attorney will spend all day and night basically sending back red lines with these things crossed out, and no matter how hard we say, we just actually cannot agree. If this is important to you, then we just have to walk away. But, they're sort of advising the startup or the foundation because either they're really just trying to rack up the hours, or they don't know because they haven't done these types of agreements and think that somehow they can negotiate these points, and they're really not.
And sometimes they put in language where they'll say, well, we're making a compromise, we'll mutually indemnify each other. Well, no, we won't indemnify you ever. If you want to work with us, you have to agree to our language.
So we just wanted to close with a few more tips, and then we'll open it up to question and answer. So one thing that you'll see in working with tech transfer offices is that most tech transfer offices are severely understaffed, and they're working on a number of different projects at any given time, and are constantly, people are sort of fighting to get to the top of that pile. So we would say the squeaky wheel does get the grease, and it doesn't hurt to sort of follow up and say, where is this? And kind of get a reminder. But it also serves to try to build a relationship with the individuals who are involved and try to understand all the stakeholders, and just be polite and understanding. We're not going to go too much on sort of the fundamentals of relationships. I think there was an earlier session that sort of talked about what makes a relationship or a collaboration successful. But I think the thing that I have seen most often is where somebody will say, well, just send me your template agreement. And I say, well, okay, well, what are you trying to accomplish? Well, just send me your template agreement. And then down the road, we learned something that would have been critical as to how we would have structured the agreement in the first place. And so really being transparent and kind of getting everyone in the room and saying, what is it that we're trying to accomplish is really helpful from the outset. Kind of overshare, I would say. And then obviously this stuff we live and breathe this. We use these acronyms all the time. But it can be overwhelming and confusing. And so you should not hesitate to ask sort of, why is this going now to General Counsel? What is this acronym? Why is this provision in here? For the most part, I think that people are willing to answer those questions, and you have every right to ask. So we put up a couple of links of some agreements that you can find. NCATS has their model agreements on. We mentioned the UBMTA, is it?
Yep, the UBMTA.
And Autumn also has some other material transfer agreements. Stanford and MIT both have their sort of sample agreements online, and so those can be helpful if you're just trying to get a sense of what universities and government labs typically start with for negotiations. With that, thank you. Please, we'd like to hear more questions. Thanks.
Yes.
So I have two questions. Do you mind just going backwards one slide? So you mentioned, so two things. Do the other groups at the NIH have different model agreements? If that's for NCATS, but do the others each have their own, or are those on their own?
They might. Each institute has the authority to use their own agreement. They look pretty similar, but they might have a little bit of a different flavor.
And then the other question was, you mentioned that, I don't know if it's listed there, but the model agreement for MTAs, is that something that institutions use when they're giving out the MTAs, or that foundation, which way does it go?
Yeah.
Usually it works where you would say, we want to do this MTA, and if you're using the UBMTA, then it's sort of either party could send. If you're not, then it's sort of, we have a template, do you want us to do you want us to send ours to you, or do you have a template, do you want to send yours to us for consideration? And just to be clear, that is just, the universities that have signed on to that sort of have agreed that they'll use that as a starting point for negotiation, right? It's not that they have to use that. Is that correct?
I think that is. I mean, there are some situations where they may not want to use that, but if they've signed on, they typically do. Yes.
Just to answer your prior question about whether the agreements are all the same. So in addition to being a parent advocate, I also work in life sciences, and I'm a lawyer on the other side of the agreements. And they are very, very, very similar with some minor agreements. And I would reiterate everything you said. There are some things you just don't bother negotiating. I have to explain that to a lot of younger people coming in to work with me.
Yeah.
Leave this alone.
Do you work at a foundation or a law firm?
I'm on the board of directors of a foundation,
Okay.
and I'm also a lawyer for a medical device company.
Oh, okay.
I don't think anyone fell asleep, so that's a success. All right. Thank you guys again.
Thank you.
So thanks everyone for joining us, and thanks to our live viewers. Thank you, Amy and Mary Beth. It was great discussion. It really, I know you were harshing on yourselves about it being boring, but you did good. And I took a health information class, so I'm actually really impressed that you can remember all the acronyms. I was impressed by that. So at this time, this concludes the final breakout session of the summit. Don't forget to jump on your mobile app and take a brief survey. And we'd like to invite you to the main ballroom for our closing session, followed by the Rare Champion of Hope Reception and Celebration, sponsored by PRA Health Sciences. Thanks again, and let's give everybody a round of applause one more time.